Hi, I'm William Sovich. I'm a medicine resident at Baylor University Medical Center in Dallas, Texas. I'm presenting papillary fibroelastoma in the left ventricle, a rare disorder. So some learning objectives are that we recognize that papillary fibroelastoma are uncommon cardiac tumors generally located on cardiac valves, that we understand that papillary fibroelastoma are associated with embolic events like myocardial infarctions and strokes, and that in the right clinical setting, cardiac MRI is a very useful imaging study for evaluating left ventricular masses. So, Our Lady is a 61-year-old woman who presented to the emergency department with 2 days of intermittent palpitations with associated presyncope. These episodes of palpitations lasted for 20 to 30 minutes, were brought on by activity, and resolved with rest and meditation. Of note, she'd also had a recent TIA 6 months prior to a presentation. Past medical history was notable for long-standing smoking history, hypothyroidism, and schizoaffective disorder. On exam, her vitals were unremarkable other than a slightly elevated systolic blood pressure of 148. Her cardiac exam was benign. Her neuro exam was also unremarkable. Lab work in the emergency department included a comprehensive metabolic panel, CBC, troponin, and TSH, which were all unremarkable. EKG on presentation was normal sinus rhythm. It met LVH criteria. And there were ST depressions in V4, V5, V6, as well as 2 and 3. These depressions presumably representing strain in the setting of LVH. So as part of her workup, she underwent transthoracic echocardiogram for her presyncope, and that demonstrated an 8 millimeter mass at the apex of her LV. You can see in Figure 1A and Figure 1B the mass non-contrasted and then with contrast in 1B. She was started on IV heparin infusion for presumed LV thrombus, and she underwent left heart catheterization. Left heart cath did not demonstrate any coronary artery disease. At this point, we were less concerned for LV thrombus and more concerned about another cause of an LV mass, like a tumor. So she underwent cardiac MRI, which was consistent with a cardiac tumor in the left ventricle. Given her recent TIA, the patient underwent minimally invasive resection of the mass, and final pathology was consistent with papillary fibroelastoma. And you can see the histopathology of her tumor beneath her imaging studies. So most cardiac tumors are metastatic in origin. Primary cardiac tumors are much rarer. And then papillary fibroelastoma are not the most common primary cardiac tumors, which are myxoma, and they only represent 10% of benign cardiac tumors. These tumors are generally found on a valve, although the left ventricle is the most common non-valvular location of these tumors. On echocardiogram, they are often seen to be pedunculated and mobile. And then grossly, their appearance has been compared to a sea anemone, and they are covered by papillary fronds. Cerebrovascular accidents are a very common presentation of papillary fibroelastoma. And a study by Gowda et al. 120 patients presented with either a TIA or a stroke out of 725 patients that they analyzed, and that was the most common presenting symptom. Our case illustrates the usefulness of cardiac MRI in working up left ventricular masses, especially when the undifferentiated mass may be more likely a tumor than the clinically much more common left ventricular thrombus.